Okay, so for an IM injection, we're going to go ahead and gather our supplies as usual. We'll wash our hands. We're going to check our doctor's orders before we even start to get any of that done. And so when we check our doctor's orders, we're just going to make sure that we've got the right dose, drug, time, route, patient, and then documentation. And so we're also going to check our MAR 3 different times. So when we're getting the medication out of the Pyxis, we're going to check our MAR. When we're drawing the medication up, we're going to check our MAR. And then right before we give it to the patient, we're going to check our MAR. Other things to check for would be allergies, therapeutic outcomes of our drug to our patient. And then also when we pull our when we pull our med out of the Pyxis, we're going to check for our expiration date and our label just to make sure we have the right medication and it's not expired. So when we're gathering our supplies, we're just going to go ahead and get our syringe, just relevant to how much medication we're going to give, and we're also going to get the correct needle. And we might also get another needle so that our needle isn't dull when we actually inject our patient. I don't want to say stab. So first and foremost, I washed my hands. I went and got my medication out of the Pyxis, checked the expiration, it's in date, check the medication. So first we're going to go ahead and pull out our medication, and so to do that we'll say we're going to give 1 ml. And so we'll inject 1 ml of air into our vial to keep the pressure. So then we'll pull that 1 ml out. And so when we do that, we're also, we're just going to check to make sure we have the right amount again. If need be, have another nurse check. We'll recap just for transportation. We'll label it so we know what medication we have in our syringe. So then we're going to go ahead and get ready to take it into the patient's room. We'll go in there, check our MAR. We're going to have 2 patient identifiers. We're going to scan their armband, say your name and date of birth, ask them again if they have any allergies, just in case. I'm going to wash my hands, and then I'm going to go ahead and put my gloves on. Like if I can find. Also, when I didn't say this earlier, but when we're pulling out our medication, we're going to go ahead and clean the top of the vial. So we'll clean it, even if it's a new vial, just to make sure that it's sterile. Okay, so when we go into the patient's room, we're going to go ahead and we're going to clean our patient's site. And for IM, you can have your deltoid, your vastus lateralis, your ventrogluteal, and your dorsogluteal. So we'll just say this is our deltoid muscle. So we'll clean them, let them dry, and then we'll encap our needle. And so for these IM injections, you don't need to squeeze up any fat because we're giving it into the muscle, but we can go ahead and get a good hold on them just so that it doesn't move around. So we'll hold on, and then we'll go at a 90-degree angle. I'm just going to make sure I have the right amount again, 1 ml. There's no air in there. And so we'll go at a 90-degree angle, and we'll do a dart-like motion. So we're just going to go here. We'll inject our med. I didn't get rid of this, so we're not going to push it because it's not real. So then we'll inject, we'll pull out, and then I'm going to put this in here. If the patient's bleeding or if they're on any kind of blood thinners, we'll put a Band-Aid and hold pressure. We're going to put our syringe with our needle into the sharps. We don't need to recap after, unless it's like a safety one where you just recap. But anyway, so we'll put that into the sharps. I don't know if I'm forgetting anything. I'm going to take this off. I'm going to wash my hands. And then once I've left, I can come back and I'll assess the vitals. I'll assess the therapeutic outcome of the medication that I just gave. Is it helping? Are they having any pain? Just ask them, just in general, how they're feeling. Wash my hands before I leave. And I think we're good.